Good evening. It is 7 o'clock on Monday, the 5th of October. This is a regular meeting of the Richfield Board of Education. In attendance this evening are Deb Etchen, Superintendent Steve Anowski, Mr. John Ashmead, Christine Malik, and Todd Nolenberger. I'm Peter Tensing. Tim Paulus, I'm not sure if...
Must be the
Deb
traffic.
shook her head like she was in charge.
That's right.
Don't look at me.
That's all right. We will welcome Mr. Paulus when he arrives. Let's go ahead and move on to item 2, which is review and approval of the agenda. If there is any board member who wants to make a motion to entertain that.
So moved.
Second.
Very good. Motion by Nolenberger, second by Ashmead, that we approve the agenda as presented. All in favor, please say aye.
Aye.
Any opposed? Chair votes aye, and the agenda passes. So we'll begin moving down to item 3B, which is superintendent up-to-date. Mr. Yanowski.
So if you pan the camera over to the west side of our school board table, you will notice something.
Hello.
I am very pleased to share that we have our student board members who are joining us, and they will be joining us for the remainder of the year. You will also notice that one of our board members returning from last year.
It's me.
Yes.
You're suggesting he got reelected?
He was, yes. Jordy Chavez, Representative Jordy Chavez was reelected. Actually, we have decided as part of our work with our students to have board members representative juniors and seniors. So to our juniors who are thankfully joining us today, we're looking forward to hopefully a 2-year term with you. And also, for Jordy and Catherine, this will be your year. So I'm going to turn things over to our students to introduce themselves and just give a quick word on why they chose to represent. We're going to start with Jordy as our returning member.
Well, my name is Jordy Chavez, senior, as they've said before. I just love learning about the community, every aspect that kind of makes it run, and I just like to give my input sometimes whenever it's necessary. And I'm glad to be here for my second year.
Okay. I'm Shay Walters. I'm a junior, and I just want to be a voice for my fellow peers, and that's pretty much it.
I'm Catherine Zolmer, and I just wanted to see how all of this works and also be a voice for my fellow students.
I'm David Munoz. I'm a junior, and it sounded interesting, and I like to be heard, and I like when people agree with me, or even if they disagree with me, I like to know why. So, yeah.
Well, welcome very much. Welcome back, Jordy. We are very glad to see you back again, and I think this continuity will be outstanding, both for you and for the board. I really appreciate your willingness to serve a second term, and welcome very much, Catherine. We're looking very much forward to your input, and then David and Shay, we will look forward to hearing from you and to seeing you again next year. So we really appreciate the time and the dedication that you folks are showing in support of your school, your peers, and in support of the district. So thank you.
Thank you.
So having student voice and student presence on our board helps to keep us focused on what our main work is. And our main work is to ensure that our students are achieving the high levels. Talking a little bit about our students, we also have a conversation around our preliminary enrollment. If we recall, we're going to talk about 2 different pieces in regard to our enrollment. One is our class size, and then one is our overall enrollment for this year. Our overall enrollment report comes out fully in the Where We Are at Enrollment, published either at the end of December or the beginning of June, which provides all that data. But we do like to, in October 1, when we provide our data to the state, provide an initial overview of where things are at present. As we compare to projections, we're looking at being down around 91 students at present as of October 1. And there have been some challenges to overcome. Within kindergarten, we noted a reduction in our kindergarten enrollment specific to a reduction in birth rate, and something we're going to definitely have to plan for, because within Hennepin County, our kindergarten classes over the next couple of years, we've noticed a reduction in the 5-year-olds who will be entering our community. We also were down a little bit at our middle school, where we also can note that there's some increased competition with a couple of charters that have moved into the area, seeing a slight reduction in our enrollment within the middle school. And then within the high school, as we come to the end of the Choice is Yours program, which buses students in from Minneapolis. About 10 years ago, there was an agreement for open enrollment that provided A couple of years ago were 6 buses that went to Minneapolis for open enrollment. Last year was 2 buses. Then we also see a corresponding reduction in enrollment from open enrollment Minneapolis as we've gone down to 1 bus. So overall, those areas have added up to about 91 students district-wide. And we have been working together to make sure that our planning around our finances and around our staffing remains solid. And we have found ways to ensure that we maintain full continuity of the exact programs and staffing that we've begun with our planning. Now, on the positive side has to do with our class sizes. Numbers of that size actually reduce across the district only about a half of a student per class. But as we look specifically into our elementary enrollment, where we worked for some focused class size reductions, we're seeing almost a 2 student per class average reduction across the entire district. Within Centennial, we're just underneath 21 students per classroom. At Sheridan, we're slightly under 20, or we're at 24.5 students per classroom, and obviously half has to do with averaging across multiple rooms. 25.1 at STEM and 22.45 at RDLS. One of the things that we've talked about is that averages are one thing, but we also want to take a picture of where are we below the 25 number that we had set to shoot for. And I'm happy to say that over 80% of our classrooms at the elementary are below 25, and that there are a significant number of other areas that are at 26 and 27. You know, as we are paying significant focus to class sizes, one of the interesting anomalies we found is that if you are a parent of a student in a 26 or 27 student classroom, and there's a 23 student classroom across the hall, when given the opportunity, our parents are actually rejecting that opportunity. So what we're finding is that our parents would rather have 27 students in their class than go to a smaller classroom if it involves a transition of teacher. And what that does is it really focuses us as a board and as an administrative team on getting our planning and student placement as close as possible. But obviously it's always more difficult when all the students show up in one classroom and 3 may not show up in a different classroom. And we try to do the things that we can to balance those class sizes to create opportunities as similar as possible. We did find that if we were able to even balance within grade levels and within classes, our under 25 number would be well over 85% on target. So we're pretty pleased with that overall class size reduction, and it shows the focus of our efforts.
Questions for Mr. Nowski around the preliminary enrollment reports? So Steve, one thing that I'm noticing, I'm going to try and do some quick math, and thankfully Todd is still here to double check it. So we were 91 off projection, is that correct?
That is correct.
11 off of last year's count, but 91 off projection?
94 off of last year's count.
Yeah, okay, got it, yeah. So that 91 off projection is about 2%, a little bit over 2% off from the projection. That's
Actually, Peter, 4,400, 10% would be 440.
so 1% would be 43,
43,
right?
yeah, okay, so about that.
A little bit over 2%. All right, thank you.
Teacher got caught there.
Close.
Factor in the account.
I was really getting nervous. So anyway, that 2%, I mean, normally I think in the past we've seen a variance of about 1% from our projection. I feel like this level of variance is different than what we've experienced before. And I was just wondering if the administration has had a chance to look at our projection from last year and to see where there were places where we might have overestimated, or if we suspect that there's a dynamic at play other than the variables that we accounted for with our projecting methodology.
So I think that as we review, we didn't fully take into account in our enrollment projections some new market forces. If you just look at the senior high, for example, the reduction of Choice is Yours busing from 2 to 1 actually indicates a clear reduction of students from open enrollment. And we had made projections, and our projections had run with a similar pattern to past practice. And with that reduction of 1 bus, that obviously shows up as that reduction in the high school. And so we're also looking at market forces in terms of charter school opening and increased competition in the middle school. And then we will be most likely, and again, we're gonna obviously do the math on this, but we're gonna most likely be reducing our kindergarten projection a year from now a little bit. Because over the next couple of years before it bounces back, the birth rate is down. And so those are all areas that projections didn't quite align with the slightly changed market forces.
Yeah. So that will be in December. Is that when we can look forward to kind of getting some of the fine detail on projecting for the 16-17 school year?
Yes, that's when we bring initial numbers forward.
All right.
And I would hope and expect that this group will poke at those numbers and ask those exact questions on whether those things have been taken into account.
Other observations or questions in anticipation of December?
No, I would just say that I guess the one thing, to me, the one thing that was a big variable was the additional charter schools, the additional competition. That would have been very difficult to estimate how many people would take advantage of that or would change as a result of that. So I find that one to be difficult. The lower birth rate, I know in the past we've at least attempted to account for that.
We definitely factored that in.
Okay.
So that's something that we should definitely look at going forward. I know that we have a change in personnel as to who's going to be doing the projections. So this coming year will be interesting, and probably we want to have some people who've been around the block a little bit push back and ask for answers so that we can get as good information as possible.
Yeah, absolutely. I mean, I think that as far as the birth rate goes, what my recollection is that there's a number of ways, number of ways to kind of peel that onion back. Do we look at just the zip code? Do we look at Hennepin County on the whole? And what, exactly what sort of percentage do we look at? And depending upon how you slice those numbers, you could have a significant variance in what your estimate is. So we'll just have to presumably take the more conservative route.
And that's probably, I would tend to agree with you there. I think the issue is if we were 90 kids higher, from a financial perspective, we wouldn't be concerned. We'd be looking to open up new sections. It's always easier to go up than down. And so conservatism is probably the name of the game for the coming year from that perspective.
Excellent.
Well, as we review things in conversations around fund balance, and we review things in conversation around contingency funds, these are the types of situations for which having a fund balance, I think our board guidance has been 4% to 8%. I think these are the reasons why a fund balance higher than a 4% might be a logical conversation to have us engage in the future in terms of ensuring those opportunities to maintain all of our programming. Thankfully, we've been doing a lot of work administratively to bring in extra funds and extra monies that haven't also been budgeted. So ADSIS grants that we have talked about as a board and our third-party billing efforts and also our partnership with 287, we've been working on making sure that we are finding ways to have contingencies and are enhancing our opportunities financially to cover such opportunities.
Well, and in the future, when a board member asks why we have 3 to 5 positions held back for contingency, this is the answer. And, this explains it in a heartbeat.
Yes, those are absolutely part of this, and then obviously we are down or up. If we are up, we are hiring staff, and if we are down, we are not, and then we're returning those funds as a contingency mechanism for our budget. Absolutely.
All right. So very good. We will get more detail on this in December when we start projecting for the coming year. We'll go ahead and move on to item 3, which is regarding the school activities guidelines.
All right, so I'm going to welcome Joel Miltier and Athletic Director Dave Boyd to the microphone over there for a conversation to review our administrative guidelines around school activity fees. We did this, I believe, back in June, and then we are just having an update and a brief review, but it's also an opportunity to, and I believe Joel Miltier, our Director of Human Resources, has been here before, but to welcome Dave Boyd, our Athletic Director, and have him here on our team. Please take it away, gentlemen.
Great, thank you. Well, we're here tonight to present for your information and comments one small change to the administrative guidelines, 781.1. We added a line in there separating out what was a dance line, which is actually winter competitive dance, to have that as well as a fall performance dance and a fee of $95 for the fall performance dance. This is not a Minnesota State High School League activity. It's just an activity that many of our students participate in the high school and wanted to have as an activity, so we wanted to give it that kind of light within the system as well and make sure it was called out within the guidelines.
So, questions for Mr. Miltier or Mr. Boyd? Sounds like, is this a practice that I mean, I know that the fall dance line has been active now for a couple of years. This is practice, one that we've been following, and now we're just sort of formalizing it. Is that what I'm understanding?
Yeah, I think there's been some confusion within that group in terms of what is this? Is it really a school activity? What fee do we charge? And those things have been, I guess, loose in the last couple of years, and we really wanted to formalize this, get it into board policy. This is what it's going to be, and not going to change next year depending on different factors. So I think that community is very happy that we've kind of taken these steps to formalize that.
Other questions regarding this particular item?
I guess my only question would be, looking at the list of fees themselves, I guess I'm a little bit confused on, for example, Nordic skiing with a fee for grades 7 through 12, and then a separate or a different fee for grades 6 through 8.
That's a misprint. I mean, that was done before I got in. I'm not looking back, but that is clearly a misprint. That should not be. If you look at the rest of the pattern on there, 7, 12, yes, everything else is a 7, 12 sport is they pay the high school, or if we have a middle school program, they pay that.
Yep. Okay.
So
Yeah, that's something to look at.
Yep, that'll get fixed for next time.
All right. Other than that, that's all I have.
All right. Never hurts to have 10 more eyes looking at you, right?
Well, it might hurt a little when you're standing in front of
Yeah. Outstanding. Well, thank you very much, gentlemen. There are no
Okay.
commendations for us to report this evening. We can move on to the consent agenda. We'll entertain a motion or any questions regarding the consent agenda.
I move we approve the consent agenda.
Second.
So a motion by Etchen, second by Ashmead. Is there any discussion? If not, all in favor, please say aye.
Aye.
Any opposed? Chair votes aye, the consent agenda passes. There is no old business for this evening, having been apparently quite efficient at our previous meetings. We will move on to item 6.1, which is the assurance of compliance with state and federal law prohibiting discrimination. Mr. Holge.
Yes, thank you. And this is an annual report that we are required to submit to the Department of Education at this time. It does assure that we have all the policies in place and are in compliance with all of the state and federal laws prohibiting discrimination, and I just come to your approval tonight.
So questions for Mr. Holge around this report? It does appear to be a relatively straightforward document, sort of checking off the boxes that we are complying with the statutory regulations and so forth. I do not personally have any questions. If there are none, then we can look for a motion to endorse it.
Mr. Chair, I move approval.
Second.
So motion by Nolenberger, second by Malik. May I ask for any discussion first? No. All in favor, please say aye.
Aye.
Chair votes aye, the motion carries.
Thank you.
Next item, Mr. Paternos, infrastructure project change.
Good evening. Give me 1 second here to get the projector up and going. Tonight I'm bringing forward 2 change orders, getting very close to compacting all the rest of these change orders. Hopefully, I'm keeping my fingers crossed that the next board meeting should hopefully wrap up all the change orders in the project, but we are getting very close in the process. As we kind of look at what's in the documentation that you have there, and as soon as I get this here, I can go through some charts. Allstate Communications, change order number 9. This has got a few weeks worth of change orders kind of compacted in here since I wasn't here at the last board meeting. So again, we're trying to consolidate all these, and it's a lot of very small things. If you looked at the change order sheet, $1,000, $500 items for changes, and some additional ads at Sheridan Hills, Centennial, RSTEM, RMS, and the high school for cabling locations, again, based on different classroom arrangements and office spaces as we did our final inspections. The next change order that we have is for Matrix Communications. Again, they are providing all the hardware, the Wi-Fi, the switches, and the telephones. Change order 7 is coming to redesign 3 of the data closets for future functionality. So when they came in and did the installation, they did it based on the specs of the RFP. When we went into some of the closets and looked at how they were designed based on what the RFP said, it didn't make them real functional for future expansion and actual functionality for what we needed to do currently for tracing wires back within the classes and in the closets. So we had a conversation on trying to compromise on how to do a redesign of some of those closets to make them more functional, and came up with an agreement, which is this change order, that they redid one of the closets at no cost, and then did 3 of the closets at just at a cost value of labor, rather than what they would do to make any money off of it, coming to a change order cost of $812.50 to get them redesigned in a future expansion and functionality purpose. Looking at where these change orders would be coming from, they'd be coming out of our contingency, which we planned $240,000 in there. If you notice with the previous change orders and these change orders as well, comes to a little over $185,000 total out of that contingency. So we still have a balance in our contingency fund on this project of a little over $54,000. Looking over the entire budget, we are still on track to be under what we budgeted in this project. And I still anticipate for us moving forward, even with these change orders and still what we're anticipating to come, to still maintain under our allotted budget for this project.
Are there questions for Mr. Paternos regarding this change order? If not, we can certainly entertain a motion to approve.
I move we approve the change orders for the technology project.
Second.
A motion by Ashmead, second by Etchen. Is there any discussion on the motion? All in favor, please say aye.
Aye.
Any opposed? Chair votes aye, and motion carries. Thank you very much.
Thank you.
So we'll move on to our next item. Mary Clarkson is here to present regarding the contract between the district and Park Nicollet for the Richfield Health Resource Center.
Good evening, school board members. Thank you for having me. I'm filling in for our Director of Student Support Services, Christina Gonzalez, and I am here to present for your approval the Richfield Health Services Center contract. As you all know, we've been working on the Richfield Health Resource Center with Park Nicollet. It's moving forward wonderfully, and we anticipate an opening somewhere towards the end of this year, the beginning of next year. So that's very exciting. Part of this is to make sure that we have a contract in place. You did receive a hard copy of the contract this evening. The one that you have in your that was online had one minor change. Mr. Paulus had shared some concerns, and so if you turn to page 3, under section 2.2.2, the last line talks about the scope of services, and should there be discussion about having changing that scope of services, we would there would be some discussion with the district before those services could be changed. So that was the only addition. It was one little line. We worked closely on this contract with district administration, our district attorney, Laura Tubbs-Booth, who has done these types of contract with other school districts, and then Park Nicollet, their team. And so tonight what we're asking is that you approve this contract, and I'd be open to any questions that you have. Hopefully I'll be able to answer them all.
Yes. So questions for Ms. Clarkson?
Peter, I'm Mary. The effective date's left blank on the handout, so are we looking for an effective date that makes sense? I know the center will be open year-round, is that correct?
Mm-hmm.
Okay, so, but presumably it'll be more heavily trafficked during the school year. At least that's my guess.
That's what I would
Okay.
anticipate. It's a 2-year contract, and then the district does have the option to, for whatever reason, to terminate the contract with a 90-day notice. I'm not sure that it makes a huge difference as to the contract date, but we can put a date in there that makes sense. So I know you had recommended perhaps September 1st. We absolutely could do that.
You know, knowing that we opened before that this year, I mean, August 1st, something like that, so that if it were to terminate, if we were to terminate, we would know in advance it would close, and it wouldn't be something shutting down in the middle of activity.
Okay.
I'd recommend that.
We can.
And I was hearing the timeline as either late this, and so when we say late this year, we're talking late this academic year?
I'm sorry,
calendar year.
2015, towards the end of 2015 into 2016. So either December-ish, January-ish is we're looking to open, but we don't have a firm date yet.
Got it. So, okay, no, that should be fine. I guess the only thing that was occurring to me is we would certainly want it open prior to the beginning of the coming school academic year, because catching up kids on their immunizations, that activity is heavy in August.
Absolutely.
That'd be a big activity. I do have a question just around language, and this relates to the item that you pointed us to, item 3, I'm sorry, 2.2.2, the scope of professional services, and then also the exhibit. The language on the exhibit, diagnosis and treatment of minor acute medical symptoms or problems, including but not limited, and it gives a range of minor things. Similarly with the preventive screenings, there are sort of examples. There's obviously room for interpretation in this exhibit, which I'm fine with. I have no problem with that. When we're talking significant changes to the scope or types of professional services, I guess that given that the exhibit itself is fairly non-specific, there's definitely interpretation and judgment around what would constitute a significant change. Would this be at the discretion of the district to, bring something forward, or how would that kind of work out if we were concerned?
Absolutely, it could be at the discretion of the district to bring forward, just so that you know how communication is going to be taking place. There will be monthly meetings with representatives of the healthcare center, and then also our director of student support services to talk about services, to talk about concerns. So that would be a natural place where issues would be brought up. This language was drafted by our attorney. And I know, Craig, you had some conversations with Laura regarding this, if you want to speak to that.
So we're trying to be very cognizant of the fact of having this not be a clinic that we are under the control of. So it truly is managed by that. We're not trying to provide the medical services or identify specific medical services. So that's why it is pretty general as far as that. Specific list of items is controlled by the clinic as a third-party provider and not agent of the district, per se. When we look at kind of what are significant changes, for the most part, the list of items identified are, I consider them more minor services, preventative services. We're not providing emergency services or anything like that. And so that's what we look at. A level of significant change would be a change to one of the categories or an addition of a category of service, knowing that the list probably isn't comprehensive in and of itself. The reason language was put in there of 120 days notice prior to any changes is if we receive that notice of change, that gives us an opportunity to terminate if there are concerns of what the district is, or kind of work through that process of what the intent of this clinic is, which is really kind of the primary care, similar to going to, you know the profession better than I do, so I'm not going to try to advocate specifically for that. But
and so what would be kind of the discovery process, given issues around protected health information?
Yep.
And so when I say discovery process, what I guess I'm alluding to is, how do we know what scope of specific conditions are being treated without violating confidentiality?
Well, they're agreeing to the scope of services that are in this situation. I think, as Mary identified too, is this clinic, there are other providers that Richfield Public Schools will have an opportunity to invite in to use that space. And so that service provider list is something that the district has some opportunity to kind of expand on that as necessary or in that process. And it is very much of a collaborative process. There's an advisory board that's interacting in the process. So again, we're not managing the day-to-day care that's provided in that environment, but the scope of what Park Nicollet is saying their services would be is what's articulated in that addendum. And I think there's a good faith effort to expect that that's the way that they're going to be moving forward. If we do hear that there are concerns, then I think that would be a collaborative process as well.
The other piece is that they are having those monthly meetings, so if there are specific questions or information gathering that we would like, that the board would like us to address in those meetings, we absolutely can make sure that those agenda topics are brought forward so that we can kind of manage without micromanaging.
Yes. So, and in terms of, just to have clarity, in terms of kind of the governance of the health center, if we were to sort of put together an organizational chart or sort of a stream of accountability, where does this board sit on that chart? Where does the advisory board sit? And what would be the relationship between this body and the advisory board?
That's a good question. Craig, do you want to speak to that? I can give my opinion, but I'm a little worried about tossing out opinions here.
So this is the way I look at it, and I've been involved in some of the conversations with Park Nicollet, but primarily around the contract development and the services that are being provided that way. The facility is owned by Richfield Schools. It is fully a part of the Richfield Schools. We control the use of the space. We control that we're allocating Park Nicollet to be a provider within that space. And so anything governed by the contract is specifically governed by the school board and is not, the advisory board doesn't have the opportunity to change the agreement for the use of that space separate from what the board is approving from this agreement. The advisory board is meant to engage the community in dialogue and promotion and identifying resources and services that can best be served by the school in that space in this joint partnership. As far as the advisory board, Christina Gonzalez has been more involved in that part of the process of developing a community advisory board, and I think that there would be participation of the board welcome at that, but it is not a governing board. The Board of Education is the governing board for that space and identifying the partners that can be available to use that space as far as coming down to school property.
So having talked to the former superintendent of Brooklyn Center who implemented a similar health center, the the relationship ends up being extremely collaborative. So from Park Nicolet's perspective, they have supported the build out. They have created a significant financial investment in our partnership that is now our area. So it is essentially a significant donation. Park Nicolet and us, we are working together to create that collaborative environment, but the board oversees the contract. Sort of the best interest of both parties is for us to implement an effective health center together. They are an effective service provider. We have a location and students. And obviously from a board perspective, as we look at the areas of term and termination, obviously there's a 90-day ending. If the relationship isn't going well and we were to come to a parting of the ways, at the very least 90 days would be that piece, if that situation. Now, in talking to Brooklyn Center, that hadn't been anything even on their radar, because it's one of those where in conversation, this is what we've seen in terms of coming to a contract, is it's an open dialogue back and forth, and we're trying to find the best ways to work together as effective partners.
Mr. Chair, item 2.3 in the contract suggests that there is eligibility for professional services for any individual aged 23 or younger who lives in the district or is enrolled in any school, including charter and non-public schools. Is it our intent to promote this in some way? How are we going to communicate this? Have we thought that through?
There has been quite a bit of dialogue with Park Nicolet as to, they will be the ones generating the materials, promoting the healthcare center because, or the health resource center, because obviously we want it to be used. So we've had a start of some dialogue about that, and that's what the work group is moving forward. Hopefully they will generate some flyers, and they talked about some social media, but making sure that at least those, it's the advertising is out in all of our school buildings and out in the charter schools and the private schools to make sure that community members have access and we utilize the clinic.
Excuse me, Mary, just to follow up on that, could you remind me what the age cutoff is for special ed services for students who live in the district, even if they're not enrolled in our schools?
Services age out at when they turn 22.
22, okay.
We do go up to 23 because we do have some of our students that attend our alternative learning center that can go through age 23.
So this cutoff is not fundamentally different from our special ed population cutoff?
No. No. And so we wanted to make sure we're inclusive of all our learners.
But it doesn't suggest that you have to be enrolled as a student in order to utilize the card. You can just be a resident of Richfield up to age 23.
Up to age 23.
Yeah, through age 23.
Through age
Right.
23.
That's true of the special ed population. We have to provide services to students,
Right.
you know, who aren't enrolled in our schools. So.
True.
Yep.
Thank you.
Yeah, and it also covers those younger
Are
than
you-
Right.
Ideally, we'd like to start catching our young ones earlier in the system so that we can provide additional services if needed so that they're prepared when they come to school.
Makes sense. Okay.
Other questions?
I do have a couple more.
That's okay. Ask away and I'll do my very best.
It's his area.
Absolutely.
Passion.
So, and this is I guess, just a request, I suppose. It really has nothing to do with it's an element in the contract, but it's a request for moving forward. Item 1.8, which is relative to program evaluation. And it basically states that the district will cooperate with Park Nicolet to evaluate the effectiveness of the HRC. I definitely see that as a critical piece, and we'll look forward to gaining more clarity and specificity around what that means in the future.
And I've had conversation with Ms. Gonzalez. When this idea was brought to me by our special ed department, the conversation for me is, will we be able to track its impact on our students, their attendance, their achievement, their behavior? And that is part of the data gathering process. And so they're already working an initial conversation around how do we maintain patient confidentiality and service utilization while also trying to track improvements in our students' lives and in their achievement. So we will be on top of that.
Yeah, outstanding. I think that, and I guess just the last observation, just thinking about it from a governor's perspective, I think I have clarity now around how that is to be structured. So thank you for that. And that'll just be a piece that we'll need to collaborate with Park Nicollet on, this whole scope of practice piece and kind of what that means and where the fine line sits between the board having some accountability for overseeing that.
Absolutely.
And not obviously violating the confidentiality of any individual who is a patient at the clinic. So I certainly would want to express that my overall feeling about the project is it's great, and I'm totally thrilled about it. I just want to make sure that we're being clear and upfront, with the
Absolutely. And if there is suggestions from the board about how that communication takes place, absolutely share it with the superintendent or with myself or Christina, and we can help facilitate how that dialogue happens, or if there's an interest to have someone from the board be represented on that advisory committee.
Sure.
Either way, so just
And we can
think about that and share that back.
Yeah, as a board, we can maybe, and the administration can think about what would be the best mechanism for
Absolutely.
maintaining that accountability.
Absolutely.
Yeah.
Okay.
Other questions? We've covered Mary and Craig. If there are none, any board member who is prepared to make a motion, we can entertain that at this time.
I'll move that we accept the agreement as presented.
I'll second that.
So a motion by Paula, second by Ashman, that we accept the agreement as presented. Is there any discussion? Hearing none, all in favor, please say aye.
Aye.
Any opposed? Chair votes aye, motion carries.
Thank you.
Thank you very much. All right, we will move on to item 6, which is advanced planning. Information and questions from the board. We can open things up to any board member who has something to share or something that they'd like brought up. If not, we will be meeting okay, so I gotta think about my timing here. Yes, right, okay. Our next meeting in October, for some reason I was getting thrown off by the election sitting above the October meeting on the page here. Our next meeting in October is Monday the 19th. That will be held here in the district boardroom. The general election is Tuesday the 3rd of November. There are candidates on the ballot for school board, and there's also a referendum on the ballot, so we encourage all voters to go out and vote. The first meeting in November is Monday the 9th. That is the Monday following the election. We will be canvassing the election. Usually we do that prior to, at the very beginning of the meeting, if I recall correctly. Yeah. So we'll be canvassing the election at the beginning of the meeting at 7, and then we'll move on to our regular meeting after that. Are there any suggested agenda items? Very good. I will look for a motion on adjournment before I pound the ballot.
Second.
So a motion by Malik, second by Paulus. All in favor, please say aye.
Aye.
We are adjourned.